Hi, I'm Dr. Jeff Eggert with Primary Ultrasound, and this morning I want to show you a black and white ultrasound, a portable, the SonoScape A6. We think that this ultrasound is the best combination of affordability and excellent technical features in the portable compact black and white field. When you look at this ultrasound, for example, the screen tilts. This makes it much more easy for a physician to use. As you move the scanner from one room to the next to see a different patient, you don't need to sit down. The tilt in the screen is very helpful. It also has attachments for more than one probe. With more than one probe attached, it makes your examination quicker as you change from one examination to another. In the past, ultrasounds were very large. For example, this console model. If you had this ultrasound, you need to have a separate room for it. The image quality with some of the earlier scanners wasn't always so good. So often, to get a good examination, you would need a sonographer. It also was very expensive to fix this ultrasound. Because it's so large, we really can't find someone to service it easily, and people have to travel a long ways. That makes it expensive. On the other hand, with our new compact ultrasounds, such as the A6, if there ever is a problem, we simply close the ultrasound and FedEx it overnight to one of our service technicians who's highly skilled and can do the job the right way. After the consoles, the next thing that happened was the manufacturers developed very, very compact ultrasounds. This is an example. This is an excellent, small, color Doppler ultrasound. It has good image quality. There have been some compromises to keep it small. The screen is small. The keyboard has some compromises to make it compact. And it only has an attachment site for one probe at a time. That's a bit inconvenient. The biggest problem I've had with this is some problems with reliability and cost of repair. But on the whole, it's been a good scanner. Now this is the SonoScape A6. Nice size screen, large keyboard, very convenient to use, highly mobile. With this ultrasound, you can do multiple examinations. I want to show you an example of how you might use it in primary care. Suppose a patient came to you in their 50s and the concern was about atherosclerosis. Well, we could ask all their risk factors, or what we could do in addition to the risk factors, we could look in their carotid artery and measure any atherosclerosis. I'm going to show you. It's just this easy. Now, if you look over here on the monitor, this is the carotid artery. In the upper part of the carotid, it bifurcates into two branches, the internal carotid and the external carotid. At that point, flow is turbulent. That's where plaque will tend to form. And first what we'll see is thickening in the wall of the carotid. I can measure that. For example, that measured 1.2 millimeters. Compared to other men my age in their 50s, that's an increased amount of thickening. That means I have more risk of atherosclerosis than a man my age. In fact, what we are doing is we're actually measuring atherosclerosis. That raises the question, how much atherosclerosis are in my coronary arteries? I better take my simvastatin. You could use the same SonoScape A6 for multiple applications in our primary care office. You could look at the thyroid gland to examine nodules, the carotid for screening. In fact, when we did a health fair screening, we saw several hundred patients in one day, and they were all just very, very excited about being able to actually see the disease themselves. You could use this same A6 to look at the gallbladder and examine it for stones, or the liver to evaluate for fatty liver, or the kidneys for enlargement. You could do a gynecological scan and check the uterus and the endometrium, or you could look at the ovaries. You can do all of those things with this SonoScape A6. It is a highly reliable, very, very affordable, dependable ultrasound. And we think every primary care practice needs an ultrasound much like this. We'll do whatever we can to make it affordable for you. If you have a question, just give us a call at Primary Ultrasound. Our number is 843-421-2164. Or you can get us at the web, www.primaryultrasound.com. Thanks.